Bismillahirrahmanirrahim. Today we are going to talk about edema. First of all, we have to know about these two terms. The first, hyperemia, and the second is congestion. As we know that it's mentioned in the name, hyper mean more, emia mean blood. When there is increased inflow of blood into the arteries, due to which the arteries get distended or dilated, causing a condition known as hyperemia. And this process is an active process. It mostly occurs to the sites where there is an inflammation or to the sites where the skeletal muscles are exercising, which means exercising skeletal muscles. These hyperemic regions mostly get reddish in color due to increase in oxygenated hemoglobin concentration there. Now the second term, which is congestion, mean impaired outflow of blood from the tissues. It is a passive process and it occurs systematically in heart failure and locally due to venous obstructions. These congested areas become blue red in color due to increased deoxygenated hemoglobin concentration in that affected area. Now, edema. Approximately the 60% of our body weight is water and 2/3 of it is an intracellular and the remaining is extracellular, and the blood plasma level is about 5%. Edema means accumulation of interstitial fluid within the tissue spaces. Mean when there is an accumulation of interstitial fluid in the tissue spaces, which mostly occurs due to decreased total plasma protein level. When the total plasma protein level gets decreased, reduced to less than 5 gram per dl, which is normally 6 to 8 gram per dl. If we talk in the reference of albumin, when the albumin concentration decreased from 3 to 5 gram per dl and to 2.5 gram per dl, mean when the albumin concentration is less than 2.5 gram per dl, in which causing edema. Normally the albumin concentration in our blood is 3.5 to 5 gram per dl. Normal concentration is this. But in abnormal condition, the albumin concentration is reduced to 2.5, mean less than 2.5 gram per dl. Now, here we can see this. This is a blood vessel. This is the venous end, and we can say this is a capillary bed, and this is the arterial end. Mostly, there are two main forces which are opposite to each other and causing edema. One is hydrostatic pressure, and the other is colloid osmotic pressure. The hydrostatic pressure is mostly responsible to push the fluid out of the blood vessel into the interstitial spaces, while the capillary osmotic pressure tries to retain the fluid within the vessels. At the venous end, the hydrostatic pressure is about 12 millimeter mercury. And in the capillaries osmotic pressure is about 25 millimeter mercury. And at the arterial end, the hydrostatic pressure is about 32 millimeter mercury. Now, at the venous end, there is a force which tries to bring back the fluid into the interstitial, into the blood vessels. The force is the hydrostatic pressure minus the capillary osmotic pressure, which is 25 millimeter mercury at the venous end, and the hydrostatic pressure at the venous end is about 12 millimeter of mercury. When we subtract these two factors, there will be a 30 millimeter of mercury pressure, which is capillary osmotic pressure at the venous end. Mean at the venous end, the capillary osmotic pressure is about 30 millimeter of mercury. And this force obviously tries to maintain a homeostasis, mean tries to retain the fluid within the vessels. While at the arterial end, the hydrostatic pressure is 32 millimeter of mercury. And the capillary osmotic pressure at the venous end is 25 millimeter of mercury. And the difference is 7 millimeter of mercury. This 7 millimeter of mercury is the hydrostatic pressure at the arterial end, which is responsible to push the fluid into the interstitial spaces. Now, there is another term known as effusion. It's quite similar to edema, but we can say that when the extracellular fluid collects into the body cavities, not in extracellular spaces. Mean here the point of a specific point is this: the fluid get accumulated in the body cavities and causing a condition known as effusion. For example, when the extracellular fluid get accumulated in the pleural cavity, the condition is created known as hydrothorax. When the same fluid, the extracellular fluid, get accumulated in pericardial cavity, causing a condition known as hydropericardium. While the same extracellular fluid when get accumulated in the peritoneal cavity, causing a condition known as hydroperitoneum or ASCITE. Anasarca mean when there is severe generalized edema, which is marked by swelling of subcutaneous tissues and fluid collection in the body cavities. As I told you before, there are two main forces which are opposite to each other and they cause movement between interstitial spaces and vessels. The first force is vascular hydrostatic pressure, which is responsible to push the fluid into the interstitial spaces. While the capillary colloid osmotic pressure tries to pull back the fluid into the vessel and make it run into the vessels. There are several factors causing edema. The one first is increased hydrostatic pressure. The second is reduced plasma colloid osmotic pressure. The third factor is lymphatic obstruction. The fourth factor is sodium and water retention. And the final is inflammation. Now we are going to talk about each of them one by one. The first factor means increased hydrostatic pressure. This condition is obtained when there is an impaired venous return. For example, when there is a deep venous thrombosis in the lower extremities It causes a condition known as edema to the distal parts of affected legs. In generalized increase in the venous pressure, where resultant systematic edema occurs mostly in the congestive heart failure. For example, when there is heart failure, obviously the cardiac output is reduced, due to which the renal blood flow also decrease. When there is a decrease in renal blood flow, it stimulates the renin-angiotensin-aldosterone system. The renin-angiotensin-aldosterone system causes water and sodium retention. Due to water and sodium retention, there will be increase in blood volume. When the blood volume get increased, due to which there will be a condition known as edema. At the same time, when there is a decrease in cardiac output due to heart failure and the systematic venous congestion occur. At the same time, the capillary hydrostatic pressure increased, due to which it pushes the fluid into the interstitial spaces, causing edema. Now, what's the treatment? For treatment of increased hydrostatic pressure, we have to decrease the salt retention first. Second, we have to treat the patient with diuretics, or we can also give aldosterone antagonists. Now the second factor causing edema is reduced plasma osmotic pressure. The plasma osmotic pressure is reduced due to two reasons. The first, there is a loss of albumin, or the second reason is there is reduced synthesis of albumin. For example, in liver cirrhosis, the liver is not able to form the exact amount of albumin, due to which the albumin concentration in blood gets reduced. The plasma albumin concentration is reduced. In contrast, the colloid osmotic pressure gets reduced. And when the colloid osmotic pressure is reduced, due to which the blood gets lost from the circulation. When the blood or the fluid get lost from the circulation, which obviously means the fluid is going into the interstitial spaces. As we know that the fluid when enter into the interstitial spaces in excess cause a condition. We are all familiar with it, edema. The second condition, where the albumin is an exact amount, but it is getting lost. The albumin is getting lost due to nephrotic syndrome. In this syndrome, the glomerular capillaries get leaky, due to which the albumin and other protein are excreted through urine. When the albumin gets excreted from the urine, obviously causing a condition called edema. Now the third factor causing edema is lymphatic obstruction. The lymph vessels are responsible to take the fluid from the interstitial spaces back into the circulation. The main function of the lymphatics is to take back the fluid from the interstitial spaces and bring it back into the vessels in the normal circulation. When there is a lymphatic obstruction, the reabsorption is compromised from the interstitial spaces. When there is impaired lymphatic drainage and consequent lymphedema result from localized obstruction caused by inflammatory conditions. For example, in filariasis, this is a parasitic infection caused by mosquitoes. There will be inguinal and lymph node fibrosis, due to which there will be a massive edema at the lower extremities and extragenitalia, causing a condition known as elephantiasis. And the fourth factor, which is causing edema, is sodium and water retention. It mostly occurs in acute renal failure. When there is increased salt retention, the hydrostatic pressure get increased. When the hydrostatic pressure get increased, it pushes the fluid into the interstitial spaces or also expansion of intravascular volume, due to which when the intravascular volume get increased, due to which the plasma protein, mainly albumin, concentration get diluted. When the albumin concentration get diluted, the plasma osmotic pressure get decreased, due to which the fluid runs into the interstitial space and cause edema. Now, what are the clinical features of edema? When there is a subcutaneous edema, it is a signal for the renal and cardiac disease. Due to edema, there will be impaired wound healing and clearing of infection get reduced. The third clinical feature is pulmonary edema and seen in ventricular failure. And this was all about edema. If you are new on this channel, please subscribe for more interesting videos. And thank you for your time.